Why do you believe it is important for children to receive their vaccinations? They receive them as early as they're born, so why are they important? In 1983, the Advisory Committee on Immunization Practices, or the ACIP, published the first immunization schedule for children. Now, at that time, the immunization schedule was relatively simple. During the 1990s, the childhood schedule started to become more complex as new immunizations became available. And over the past decade, the addition of new vaccines, such as the pneumococcal and rotavirus vaccines, and with changes to existing vaccines, such as the polio vaccination, it has become increasingly more difficult for providers and parents to stay abreast of childhood immunization recommendations. Beginning in 1995, the ACIP and the American Academy of Pediatrics and the American Academy of Family Physicians began publicizing an annual childhood immunization schedule. So first, we will review the reasons it is important for an infant and child to be vaccinated. Secondly, we will review the different vaccinations that are given and the record keeping of the vaccines. And lastly, we will review the cost of vaccines and eligibility. Now, based on an article by vaccineinformation.org, vaccinations protect children from serious illnesses and complications of disease. Preventable vaccines, which can include amputation of an arm or leg, paralysis of limbs, hearing loss, convulsions, brain damage, and death. Vaccine-preventable diseases such as measles, mumps, and whooping cough are still a threat. They continue to infect U.S. children, resulting in hospitalizations and death every year. Organizations such as the American Academy of Pediatrics and the American Academy of Family Physicians and the Centers for Disease Control and Prevention all strongly support protecting children with recommended vaccines. If children are not vaccinated, they can spread the disease to other children or anyone ill that has a weak immune system, such as someone with cancer or someone who is very elderly or someone who is too young and small for the vaccines, like newborn babies. The vaccines will protect you, your family, those around you, strangers. It helps protect you, and it helps protect others. They're safe, they're effective, they can save your child's life. To make sure the vaccines are safe, they undergo a careful, lengthy review by scientists, doctors, and the government, as they are strong supporters for children being vaccinated. There is a series of vaccinations given from birth to 18 years old and given into adulthood as well. In the first year of life, a baby will receive most vaccines at almost every well-checked visit with the pediatrician. If your child misses a vaccine, it can still be given by scheduling an appointment with the pediatrician's office, and the schedule would not need to be started over. Most vaccines are given in 2, 3, 4, and 5 doses. The following list is the vaccines given: varicella, known as chickenpox; DTaP, which stands for diphtheria, tetanus, pertussis; HIB, which is Haemophilus influenzae type B; Hep A, Hep B, which is hepatitis A and B; the flu; MMR, which is measles, mumps, and rubella; the IPV vaccine, which is polio; PCV13, which is the pneumococcal; and RV, which is the rotavirus. The CDC can easily follow and has an easy-to-follow and printer-friendly version that can be printed and followed. The hospital or the pediatrician's office will also give the parent a vaccination record card to keep track of the vaccines as they are given. The two-sided card shows the vaccines and the time frame it should be given. The nurse will fill in the date next to the vaccine given, and the record is also noted online at MTRAC2, a Texas immunization registry. MTRAC2 is a helpful system for parents and can be accessed if the paper record is lost. It can also help for school. It also allows for schools to be and other organizations to pull up and show that your child is vaccinated. Now, vaccinating your children will save a parent time and money for medical bills, medication costs, and any long-term treatment a child may need. For parents who cannot afford health insurance, there is an alternative program called the Vaccines for Children, the VFC program. This program is federally funded and provides vaccines to children at no cost. A provider's office can register a VFC provider by going online to health.mo.gov/living/wellness/immunizations/VFC-providers.php. Now, a child is eligible for this program if he or she is younger than 19 years of age, a Medicaid recipient, uninsured, or underinsured. The underinsured may have a benefit plan that doesn't cover vaccines, and with the VFC program, the vaccines will be free of charge to the family. Texas Children's Hospital operates mobile clinics that also provide vaccinations free of charge, and they travel to low-income neighborhoods. In conclusion, parents will do anything to protect their children, and one of the best decisions is to vaccinate their child. There's no excuse as to why a child is to go unvaccinated. As stated in the vaccineinformation.org article, we all have a public health commitment to our communities to protect each other and each other's children by vaccinating our own family members. Children's health should be on top of parents' priority list, and the best way to do that is to vaccinate your children. Thank you.